is yours.
Dear Chairman, dear colleagues, my name is Zoltan Szelenyi. I'm from Central Europe, Hungary, and I try to add some further information regarding the previous presentation regarding to twin pregnancies. So in this presentation, I would like to connect pregnancy loss and twin pregnancies. Just to place myself on the map, I'm coming from Hungary, Central Europe. We have there in the country altogether 400,000 cows. That's meaning around, with the young stock, so together we have 400,000. That's meaning around 250,000 dairy cows, which is mostly Holstein Friesian, producing in the same level as the previous author mentioned. Empirical twin pregnancy rate, which is meaning twin pregnancy ratio at the time of birth. We did some surveys about that, counting on several farms all over the country. At the time of birth, it's always between up to 6, 7, 8%. What I would say, some exceptions, but the maximum is around 10 in some farms. The appearance of twin pregnancy at the time of the early ultrasound examinations, I mean the early pregnancy checks, in my practice it's around 10 to 15%. There are some differences between farms, and there are some differences between seasons as well, according to my experience. Pregnancy loss, a few years before we have counted from early pregnancy until day 22, so drying off, until drying off date, that was around 16%, and still then it's seeming to be a stable number, of course with some special exceptions like in the summer or some other environmental factors can affect this. In the practice, we are doing a so-called confirmation of pregnancy always around day 60 or 57, 60. The losses used to be in a not hot season up to 10% we are losing. So that's how we are monitoring pregnancy loss. Sorry. Frequency of cavitary corpora lutea was just recently counted by a PhD coming from a research institute in Hungary. It was somewhere between 15 to 20% during the regular clinical examinations of cows. Okay, in the study that I'm performing now, we have added or we have summarized the pregnancy loss results of 3 different farms in Hungary, located all of them in central Hungary. It's a time of 10 months. I have excluded the summer season, so therefore the data collection has begun in October, in the mid of October, and I have ended in the next year, May, the data collection. So hot months, we are having hot months mostly during from May to August that I have excluded. Each farm was visited weekly or every second week, and I have excluded also those animals where the diagnosis was not 100% sure at the time of the first diagnosis. So low amount. You mentioned some animals which were tested again and again. Those ones I have excluded for the numbers in order to be able to perform statistics. Altogether, I had 1,200 pregnancies, and out of it, more than 105 was twin pregnancy. That's representing 8% at the time of early pregnancy examination. Singleton was the rest of it, over 90%, and I have divided singleton pregnancies to right and left sided pregnancies, and more or less the half of it was right and left. A little bit more right-sided pregnancy was among the singletons, while among twin pregnancies, more twin pregnancies were unilateral twin pregnancies. After the first pregnancy examination, we have followed the animals. The confirmation of pregnancy of either twin or singleton pregnancy was done by rectal palpation by the technicians, and also the dry-off check was done by rectal palpation by the technicians. And we also collected the calving data, that the presence of stillbirth events. During data collection, it was a question just right now, we have collected the data of the previous treatments before the pregnancy was occurring, so either from natural oestrus or from prostaglandin simple prostaglandin treatment, or from oestrus. On these farms, the so-called backdoor offsync program is running, so there is no longer synchronization programs that are present for the first inseminations. And we have also recorded the presence of cavities in corpora lutea. And after it was going under a statistical evaluation. First of all, about the results. First, the evaluation of twin pregnancies. There was no farm effect on, so there was no farm where more twinning was occurred. Every farm had a twinning ratio with around 8%, and there was no any kind of, because we had a little bit more animals where pregnancy examination was done at the first week in the 2-week interval here, but there was no difference either in the further data. The occurrence of cavitary corpora lutea was much higher among singleton pregnancies. In twins, it was that low that we couldn't count with the further losses, because out of 105, there was 1 or 2 animals with cavity, with twin pregnancy with cavity. So a really small amount of cavities are occurring in pregnant animals. And as I told you, we have collected the data. The hormonal treatments before artificial insemination did not affect the pregnancy rate at any farm. It was an independent factor. Let's see the losses. Counting from this amount of singletons and this amount of twins as 100, the losses between the first ultrasound check and the confirmation by manual palpation was in both farms around 5%. The losses until the further check, until drying off, was further around 6% in both groups. This representing a lower losses of total losses like in the previous lecture. And these losses between the singleton and the twin groups were not differing at any time point, and we were running several statistical evaluation in order to be able to find some difference between the time points, but all these efforts were unsuccessful at the beginning. The serious and dramatic difference between singleton and twin after carrying out or maintaining a twin pregnancy was visible at the time of calving, where we have to distribute twin pregnancy stillbirth events, that 1 stillborn or 2 stillborn animals. Altogether it was 16, and 4 cases. In 4 cases it was 2 stillborn offsprings. Therefore, the total outcome, the total viable calf outcome of this whole thing was much, much less in cases of twin pregnancy. So, when summarizing the late embryonic and early fetal mortality, and not only early and total fetal mortality in the cases, no time point effects and no farm effects were on losses. And in cases of singleton pregnancies, there was no laterality effect. So it was no difference between the right and the left-sided pregnancies. Yesterday, a Japanese colleague, I really don't know his name, but he was talking about the effect of laterality in case of, I think, synchronizations. And surprisingly, there was no statistical effect. However, the numbers were suggesting that there should be statistical significance. but there was no statistical effect, there is no statistical difference between the losses of the unilateral and the bilateral pregnancies. Furthermore, in cases of singleton pregnancies regarding to cavities, as I told you, from twin pregnancies we didn't make a cavitary and non-cavitary group due to the low number of animals, but in singletons we were able to form 3 different groups, and everywhere in, compared to the animals with compact, so full structure corpora, corpus luteums, had less pregnancy loss to compared with cavitary corpora lutea, significantly everywhere. And surprisingly, animals with 2 corpora lutea had also at the time of the first check significantly more losses. That was a surprising result. Furthermore, at calving time, there was no study, there was difference, but not statistically significant between singleton and twin calvings, so neither by singleton and twin calvings and nor by unilateral and bilateral pregnancies. The stillbirth ratio, as I mentioned, was dramatically higher in cases of twin pregnancies. As an outcome of this, as I mentioned, less available calves were available. Yeah, less available calves we got from twin pregnancies. To run a small discussion regarding to this, we still have time. So the prevalence of twinning is the same what I have earlier in the country. There is one report from Spain, from the group of Professor Lopez Gacius. They have reported once 20% of twinning rate, I think a few years before. I never had that experience in Hungary. It's never exceeding 15% if we are counting high enough numbers. So maybe there is some genetic difference between animals there and by us, and that can be the explanation. Regarding to pregnancy loss, losses are, from these data, it seems that losses are happening at the time of the early ultrasonography. That's again confirmed by a study again from Spain, where they have monitored animals between 25 and 32, and there were serious differences between singletons and twins. But from the practical point of view, we can manage our cows that not suffering more losses in case of twins. Every literature says that unilateral and bilateral pregnancies are differing in losses. In this study, maybe due to the numbers, statistical difference was not found. Therefore, we can name a consequence for the practitioners to confirm and to identify twins as early as possible and to manage these pregnancies, because the dramatic difference is existing at time of stillbirth. So as part of the reproductive management, the calving barn is the place where it seems now, from these data, where we can reduce truly the losses from twin pregnancies. Moreover, it really came out from the numbers that cavitary corpora lutea, which is in the literature showing up as a non-pathologic structure, because cavities can occur in corpus luteums and they can be filled with fluid, and their size is changing during the reproductive cycle, and they are not affecting pregnancy length, and so on, are do affecting pregnancy losses. So it's a question, I think, if cavitary corpora lutea with pregnancy are pathologic structures. I can conclude from these data. These were my thoughts and data regarding to twin pregnancy. I'm waiting for the questions. Thank you very much.
Thank you very much.